Okay gang, listen up. We wouldn't have thrown this video together if it wasn't important. We have a short video to show you how we're going to be transmitting 12 lead EKGs. So, give us 9 minutes of attention and you're going to learn something that may enhance our patient care. Good afternoon, my name is Dean O'Neill. I'm with the City of Oldsmar Fire Rescue, and with me today is
Charlene Cobb from Sunstar Paramedics.
And today we're going to talk about a new procedure for transmitting 12 lead EKGs from the back of a Sunstar unit by use of their OMG, their onboard mobile gateway. This will allow us to send 12 lead EKGs to PCI facilities with the intention of trying to decrease the door to cath lab time for these patients. By sending a 12 lead EKG with patient information like last name, first initial, a social security number or date of birth, will also allow these PCI facilities to compare old EKGs on patients they may have already seen. The goal here is to decrease the door to cath lab time because we realize that time is muscle, and whatever we can do to decrease that time will benefit our patient.
Okay, so let's see what that's going to look like on the monitor.
Remember, we're going to be multitasking, so while we're setting up our Lifepak 12 to send a 12 lead, we also need to be entering patient information on it. To do that, let's choose Options on the right side of your Lifepak 12. Patient will be highlighted. Push the toggle button to accept patient. Choose the last name by pushing the toggle button. Please fill in the patient's last name by selecting the appropriate letters by pushing the toggle button in to accept each letter. Upon completion of the last name, push N to exit. Select first name and enter the patient's first initial. Choose Patient ID and place either the patient's social security number or date of birth in. Remember to include the hyphens. Now you're ready to complete your 12 lead and transmit. Transmission will be accomplished on board the Sunstar ambulance. The onboard mobile gateway USB connection is located in the action area. Connect the USB Lifepak cable into the onboard mobile gateway USB cable end. Push the transmit button on the left side. Data will be highlighted. Press select using your toggle button. Select report. Select 12 lead. If there's more than one 12 lead, select the one you're interested in sending by using your toggle button. Select the site and choose the appropriate PCI facility to transmit to. Before pressing the send button, verify the information you will be sending. Only send 12 leads, no code summaries or other data. Once verified, select Send using your toggle button. The Lifepak 12 will begin to connect and then transmit the data. The bottom of the screen will read connecting for about 20 seconds, and then it will sit at 99% complete for about 2 minutes. Upon completion of the transmission, the monitor will print a transmission complete summary.
This is going to take some practice, so on every patient over the next few weeks you should be running an EKG and putting in the data on these patients so that you can get the practice, that you can get this down when time is critical.
And remember, we can multitask. While somebody is setting up the Lifepak 12, as far as information is concerned, we should be doing all our patient care activities, including making sure we have good lead placement to get a good 12 lead EKG.
One of the pitfalls that we see here that people will hit the send button accidentally when they're moving the toggle back and forth. It's important to make sure that you don't hit the send button before you verified all of your information.
If you've done a 12 lead and you notice that you're going to call this a stimular, two things need to happen. If you've not entered the patient's information, make sure that gets done and contact med control for our STEMI patients.
Here you'll see that the transmission has been completed, and it'll give you all of the information, including the fact that the patient's name and the 12 lead went through to the PCI facility.
Okay, now we're going to talk about transmitting a 12-lead EKG from a Lifepak 12 that had been turned off. So, turn it on, and just like before, the onboard mobile gateway USB connection is located in the action area of the ambulance. Connect the USB Lifepak cable into the onboard mobile gateway USB connection. Choose options. Select Archive. Select Yes to enter the archive. Press Edit to verify the patient information. If the patient's name has not been added, enter the patient's name, social security number, or date of birth. And once that's completed, press the home screen button. Now press Send Data. Select a patient. Select what report you want to send. And remember, we're only sending 12 leads, no code summaries, no other data. Select the site. And before sending this, verify your information that you have the patient's name, that it's a 12 lead, and what site it's going to. Then select Send and press. The Lifepak 12 will begin to connect and then transmit the data. The bottom of the screen will be connecting for approximately 20 seconds and then will sit at 99% transmitting for about 2 minutes. Upon completion of transmission, the monitor will print a transmission complete summary.
Please remember that the first responding units that are there on the scene that are going to be performing a 12 lead, once they notice that it's a STEMI, can start entering this information immediately so that we do not delay the patient care. That's important. Also, keep in mind that if you're having a hard time transmitting and if it's taking you longer than 3 minutes to transmit this, or if you're at the ramp of the facility that you're transporting to, not to sit in the back of your unit and try to transmit this. Just unplug the whole thing, take it into the facility, and let them know that you were unable to transmit. If you have the opportunity en route to call medical control and let them know that you're having a hard time transmitting, they can relay that information to the facility as well.
Two things are going to happen here. If you do a 12 lead on somebody and you think that this is a STEMI alert, if the patient information has not been entered, let's get it entered in the Lifepak 12 and call med control for your STEMI patient.
One of the things that you want to be careful of after you've done your transmission is making sure that this is disposed of properly or brought back to headquarters, because it does have patient information such as their social security number or their date of birth on it.
The ability to transmit 12-lead EKGs to PCI facilities is becoming a standard of care. It's used in several counties in Florida around here, so it's important for us to get on the bandwagon and be able to see this as a function of patient care. One thing to remember is this does not delay or impede our patient care activities. We still have enough hands on scene to make sure that we treat the patient, we get a 12-lead on the patient, and we transmit a 12-lead EKG to the patient's PCI facility for further treatment.
Thank you very much for your time. We hope that this will help your patient have a better outcome by having quicker treatment. Thank you. Have a good day.
What she said.
No, let's do that again.